And good evening and welcome to All Angles. I'm Dion Jackson Miller. Very special welcome to those of you watching online at onespotmedia.com. Now, today in the program, we're going to be talking to about healthcare workers, I should say, who contracted COVID-19 with various outcomes. Now, a little later on, we're going to be hearing from Ryan Cunningham. He's a husband of Nurse Cunningham, the nurse from the Savannah Lamar Hospital in Westmoreland who died of COVID-19. We're also going to be talking to Lloyd Jarrett. He's a Jamaican working in a healthcare facility in New York, and he developed COVID and was actually afraid of going to hospital and ended up passing out more than once at home. We'll hear his story. Before then, though, let's go to Dr. Chadwick Clark of Iris Medical Services. He's a general practitioner who came down with COVID-19. Healthcare workers are at the forefront of the fight against COVID-19. As we speak, they're healthcare workers in isolation, in quarantine, battling the symptoms of COVID. We're here at the Malines Medical Complex to talk to Dr. Chadwick Clark, a healthcare worker who got COVID but recovered. When the pandemic started, we started to see these scenes coming out of Italy first and then New York, hospitals overrun, doctors and nurses stretched. Tell me, what was your feeling at that time here in Jamaica where we weren't experiencing that?
Well, I mean, I just thought it was a matter of time. You know, Jamaica is a huge tourist destination. We have people coming from those countries from all over the world. Obviously, they would come here. I didn't think that our protocols were necessarily robust enough. I don't think there's any protocol that is robust enough or was robust enough at the time to prevent, you know, it coming to our shores. You know, I just thought that it was just a matter of time before we started to experience similar issues.
So when did you start to show symptoms?
All right. So it was actually, funny enough, it was actually election day. Like it was the day of the election. My parents and I went out and we were coming back. I was driving and I just started to feel very not myself. I didn't even have a headache. I just, I think the term that we use is malaise. You just feel unwell. Then I got home, started sweating, started having a headache. The headache started building. And then that was it. You know, I said to my mother, I said, hey, you know, I said, hey, you know, I think that something might be happening. I think I'm going to have to, I think you guys should stay over there and I will stay over here, and I think that for the time being I should lock myself in my room and you guys should probably just bring me food. Alright, that was that. And then yeah, that was it basically. So election day going forward, I thought, yeah, something is happening with me. And then the symptoms got worse after that.
So did you get tested?
I did get tested. You know, that was a bit of a saga. I actually tried to get tested at Spanish Town Hospital. They told me that I didn't have, at the time I had fever, joint pain, muscle pain. I was starting to lose my sense of taste, and I was sweating. I was very tired. I didn't have any shortness of breath. At the time I didn't have any coughing. They told me that they didn't think that I had, well, I wasn't sick enough to get a test at Spanish Town Hospital. I should go to the health center. When I went to the health center that was nearest to my house, they said that, and they didn't think that my symptoms were severe enough to warrant a test at the time. But, you know, I insisted and, you know, I got the test and it was positive, so, yeah.
So you say your symptoms worsened, so tell us how, what happened?
All right, so at first, I don't know if you've ever had dengue or chickpea.
I have not.
Not, okay, but the symptoms is just basically, it's very general symptoms. Muscle pain, weakness, headache, fever. Sometimes you can have pain behind your eyes. Sometimes with dengue or chickpea, you can have like an altered sense of taste. It's very similar, except for, you know, the respiratory symptoms, which you can have with those as well sometimes. Now, viral illnesses can give you a whole host of symptoms. So for me, headache, joint pain, muscle pain, weakness, and then I started coughing. I had a really bad cough for about 3 weeks, right? Chest pain.
Tell me more about the cough, because I've heard about COVID coughs.
The cough. So initially it just started as kind of like I mean, if anybody else had ever had sinusitis, it's just kind of like a dry cough with very, scant amounts of mucus coming up. And then it started to get more frequent. Like I was coughing so frequently that I started to have pain. Like I started to have pain in my abdomen. It felt like I was going to cough until I gave myself a hernia. Like I was actually genuinely concerned about that. I was having so much coughing.
You couldn't stop coughing.
I could not stop coughing. Like I couldn't stop. Even when I was set to be released from quarantine, went to the health center. When I got there, I was still coughing so much that they were just like, okay, well, no, you have to stay home. Like I was coughing like in public. I mean, I had my mask on and stuff, but they were just like, no, you have to go back home.
So is a cough itself, because I've heard some people say the cough itself is painful.
It is painful.
Meaning what? Describe if you can.
It feels as if, I don't know, it almost feels like whatever tube the air is, I mean, just using these words, the air passes through to enter your lungs. It feels like it has become very, very narrow, and that the side they're rubbing together. It's like a rubbing feeling. It almost feels like there's Scotch-Brite rubbing the inside of your airway. Like when you cough, it's like it's rubbing together. That's what it felt like to me anyways. Like a burning, grating kind of feeling. That's what it felt like.
Were you afraid to cough?
Sometimes, yeah. Sometimes I would hope that, okay, well, all right, I'm going to just do one big cough, and then I will have to cough again for like the next 5 minutes. But then invariably, the cough will begin again in the next 30 seconds or so.
Did you have pain associated with the COVID?
Oh yeah, I had joint pain, I had muscle pain. At one point, for about 2 or 3 days, I actually started having these shocking pains that were running from my neck and the center of my back into my arms and legs. And I know that viral illnesses can cause some issues, some nerve issues. So I was actually very scared at that point that I was going to have some kind of neurological deficit after I recovered or something. But then it went away, thankfully.
How long did that last?
About 3 days, about 3 days. So I was in bed.
Intermittently or constantly?
Pretty much constantly for the 3 days. It was like that. Yeah, so I was really concerned about that. Yeah.
So from start to finish, about how long did it take for symptoms to go away?
For my symptoms to go away completely? Okay, so they extended my quarantine for about 3 more days. And then I think for about 2.5 weeks after that, I was still coughing. I was still, not as frequently as I was before, but I was still coughing and it was still painful. About that. But all the other symptoms, the pain, the weakness, that kind of thing, they went away. No, not the weakness. I still had a little bit of weakness, probably about a week after.
Have you been left with any symptoms, long COVID, as they say, lingering symptoms for weeks after?
Not really. I don't think so. No, I think I made a full recovery. Though sometimes, I get the short of breath and I wonder, but I don't think so. I think I'm fine.
What's your thoughts, though, on healthcare workers being obviously on the front line? Mm-hmm. Many of them who are in the public sector probably see many more patients a day than you. You have friends in the system, no doubt. Mm-hmm. Are you concerned for them?
Extremely. Thankfully, they're vaccinated, but definitely of the population, they have the highest risk, of anybody. Them, the nurses, all the other staff that work in the hospital. It wouldn't surprise me if tomorrow 3 of my friends messaged me and told me, I had a COVID test and I was positive. Because what we also have to understand is they're not just interacting with the people who are confirmed, they're interacting with everybody who is sick who comes to the hospital, who may or may not have COVID. While everybody else gets to go home on the weekend or whatever, work is over, they get to go home at 12, they go home, maybe they're exposed on public transport. We're talking about maybe hundreds of people per day passing through an emergency department. You have to interact with every single one of these people. So their risk is very high.
Should we be doing more to protect them?
I have friends who have told me that at the healthcare facility that they work at, they're given, they're basically rationed PPE, so masks, etc. So you actually, your question, now that I've thought about that a bit more, definitely I think there should be more done. I don't think healthcare workers should be rationing masks and certain protective equipment, that kind of thing.
I always hear healthcare workers speak about the negativity towards them, and it seems that during the pandemic, that seems to be affecting them even more. Do you have a comment on that?
It's a very interesting thing that happens in the Jamaican population. People who are higher up in the administration are seen as kind of like the saviors. These are the people who will make the things happen that will have, you know, us kept safe and healthy and stuff. And people think that when they go to a healthcare facility and a doctor or a nurse or a porter or a PCA is unable to give them the standard of care that they think that they should get, right? This is not to say that we think that there should be a low standard of care, right? But, you know, when people don't get maybe sometimes what they see on TV, or, you know, maybe they went to the hospital at a time when they, you know, it wasn't burdened. You come into a packed emergency department that's understaffed in terms of everybody. I don't think there's any hospital in Jamaica that is adequately staffed to international standards anyway, right? They expect that we can do the same things that would be done overseas for them, and we can't. It's basically impossible. Yes, I know that there's some, you know, you must have some encounters with healthcare workers where, you know, maybe they're not as professional as they should be. But I do believe that by and large, the healthcare workers make a significant effort with the little that they're given, right? You know, basically been given a basket to carry water, and they try their best.
Okay. Have you since been vaccinated?
Yeah, man, long time. As soon as I could. You know, I don't want to end up in an ICU. I'd rather, even if I am going to catch it again, I'd rather be vaccinated and just have a cough for 10 days or whatever than end up on a ventilator in ICU and have my kidney shut down.
As a doctor, what are some of the more serious complications you've seen?
Well, to be honest, most recently, you know, I had a patient who was hypertensive, and he didn't see him for a couple of weeks. Then he came to the office, very haggard looking, you know, tired, short of breath, just not looking himself. And he told me, you know, Doc, like he would say like a week or XYZ time ago, I tested positive for COVID, and it's been hard, you know, short of breath, blah, blah. But anyway, he recovered, and I helped treat him and stuff. And a couple of days, I tested him. His antigen test came back negative. A couple of days after that, his legs started swelling up, and I sent him to do some labs. And the lab actually called me because they were so concerned about the values that they got back. His kidneys are basically done. They're shut down. That's it. And it doesn't seem to be a situation where it's just like an acute change in his kidney function that will recover. It seems like this will be a long-term thing for him. You know,
and that's emerging as one of the impacts of COVID?
It seems to really be one of the big ones, really. Impairment of kidney function going forward as permanent, and lung function as well. You have a lot of people who have what we call post-COVID lung disease. They have impaired lung function. They may still be, you know, maintaining their oxygen saturations on regular air, but they do have some loss of function. Like when you do an X-ray on them, it's clear. You can see the inflammation, you can see the damage.
Still to coming all angles.
She's not feeling well, understand, and she's not looking. Herself, she was sad, and the doctor said that, boy, you know, she needs to go to the hospital right away.